Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. I'm joined by a special guest, a director of intelligence, Donnelle Jageman. Please introduce yourself, Donnelle.
Hi, Cole. Thanks for having me today. My name is Donnelle Jageman. I'm a director of intelligence at SG2, which is a sub company of Vizient. And in my role, I actually specialize in orthopedics.
Very exciting. Orthopedics, I've heard, is a big area for this intelligence and strategy work.
Yeah, orthopedics often is an area of growth and a lot of opportunity for health systems and along the entire spectrum of hospitals, everyone from community health systems to academic medical centers. And it's really an area of volume growth too. There's so much happening in orthopedics from site of care shift to increase patient eligibility for procedures that make it a really exciting area right now.
That's very interesting. I actually was not aware of that at all. I had seen a few organizations who specialize in that, but I didn't know
Mhm.
why. So that's interesting.
Yeah.
You got an MHA originally, right? And I want to ask what caused you to get that? Why did you go in that direction?
It's really interesting because I'm actually a first generation college student and college graduate now. And when I was in undergraduate at a liberal arts college called Washington and Jefferson College, I actually triple majored, and
Huh?
none of them were exactly healthcare related. I started with environmental studies and German, and then actually added on psychology to my majors as well. And as a child, I was one of those kids that was like a fan of the show ER and Strong Medicine, which was on Lifetime. I'm sure that's more of a niche show for people. And I wasn't quite interested in being the doctor, but I was like, what if I was the person in charge?
Mm.
And as I was going through undergrad, I didn't really know that it was possible to study healthcare administration. And to people in our field, I'm sure that sounds crazy, right? Because we're all like, oh, I have a bachelor's in healthcare administration, or I have an MHA now. So I just went and studied things that I found were very interesting. And I'm very thankful for having studied those because it actually brought me back to what I was interested in, which was how our community's health status relates to our ability to care for the environment.
Mm.
And that's really where I got back to okay, I am still interested in healthcare in this way. And then I was taking these like really interesting psychology classes like industrial organizational psych
Mm.
and organizational behavior. And then I started looking at graduate programs and I found healthcare administration and I knew that was what I wanted to do.
That makes a lot of sense because it's those kind of areas of psychology I think that make really good organizational leaders as well. As when you have
Mhm.
that high level of emotional intelligence,
Yeah.
and I like how you connected that to the environmental health. We had another environmental health graduate on who went on to her MHA, and it seems like it's a good area to gain kind of a more macro perspective.
Mhm. It's very interdisciplinary, just like healthcare administration is, when you're taking in healthcare administration finance and revenue cycle and the clinical aspects and strategy and medical group management and all of these things. And so many of us are generalists or specialists in one of those areas, but really it's about the culmination of all those skills. And in environmental studies, you're doing kind of the same thing where you're taking things like bench science and sociology and environmental psychology and economics. And that's what makes up environmental studies. So it was easy transitioning academically and also just from my kind of innate natural skills. And it still fulfills me to this day. What I also find interesting about it, and I don't specifically work in the area of sustainability and healthcare, but healthcare is, as an industry, one of the worst polluters. We
Mm.
create so much waste and use so much energy. So even though, my work isn't directly related to that, it's all kind of flowed together over the years.
Absolutely, yeah, no, very cool. I also appreciate that because it helps show that whatever major you decide in undergrad, it will help connect to what you're doing now, which is very cool. You went on, you got your MHA, And then during that, is this your first, this administrative residency, I believe is what it was called, right, at the time?
Mhm.
Is that your first introduction? I know that you were a planning analyst, you worked in strategy
Mhm.
there. Is that your first introduction to strategy?
So at my MHA program in at Penn State, the administrative residency is that internship you do before your first and second year on a residential program. That's what they called it. I'm sure
Okay.
other programs call it different things. And that really was my first exposure to even working in a health
Mm,
system. I spent my time in undergrad studying abroad and taking classes during the winter semester related to environmental studies. I didn't do any internships or anything. So that was actually my first internship experience and my first exposure to healthcare and to strategy. I was very fortunate to work under the chief strategist at Mount Nittany Health,
mm,
who was actually an adjunct faculty at Penn State as well. And at the time, there wasn't a planning analyst there. So I was serving as the planning analyst all
wow.
summer. And then when the fall came, he was like, "You can't leave." Um, so I found a way to work with the university where my teaching assistantship stipend was actually used to support my work at Mount Nittany Health. And they shared the financial burden of that between the university and the health system, so that I could continue to get experience, and so that there was a stronger relationship between the local health system and Penn State. I was at Penn State University Park, and for those who are not familiar, that's not where the hospital is.
Mm.
That's not where Hershey Medical Center is.
Oh, really?
So Penn State is in State College. The medical center is in Hershey, Pennsylvania. So the medical center in State College, where all the majority of the students are, is actually a community hospital,
Mm.
an independent community hospital. And so it was really awesome to strengthen that relationship while also getting so much experience there.
No, absolutely. That is a very incredible experience working right under that individual and being able to extend it out.
Mhm.
With that extra experience, you still decided to go on to do an administrative fellowship after your MHA, right?
Yeah, I thought it was critical for me because I definitely had less experience than other folks in my cohort when it came to internships and even just working in healthcare. So many students, and this is great that they had this opportunity, shadowed physicians or, had some other kind of undergraduate level internship experience. And I also wasn't sure what I wanted to do still. I knew that I really liked strategy, but that's such a difficult area to get into. There's so few positions, and over the years, they have become even fewer and fewer as systems consolidate and really pare down their internal strategy teams. So I decided to go do a fellowship. I thought it would be a great opportunity to see different parts of the organization as well, because at Mount Nittany, I was really just dedicated to the strategy department.
And during that fellowship, did you get exposure to more kind of strategy areas, or was it more general? What was, how did that benefit you?
Yeah, it was very high level. And I always point this out to folks that I talk to because Spartanburg Regional isn't a national name in healthcare like the Cleveland Clinic or, Mayo or something. But when you go to these smaller places, I find in my experience and when I talk to other folks, you actually get higher level
Mm,
experience. There are more doors open to you. And I was very fortunate at Spartanburg that my preceptors were the chief operating officer of the entire health system and the president of the flagship medical center.
wow.
So I spent all my time with these folks and I really most of my time with the vice president cohort there. So I had a lot of exposure to medical group management and the strategy around that, including transactions, acquiring new practices, which, to my surprise, would help me later on in a different position in my career. And then I also got exposure to um, acquiring a bankrupt hospital in their market. So when I was there, Spartanburg Regional was looking at acquiring Union Hospital, and they had declared bankruptcy. So I was involved in those discussions and got exposure to the conversations around what that would take as well.
That does make a lot of sense, what you're saying with your director of physician acquisition and
Right.
integration. So that makes a lot of sense. So what you've done is you went from there to Tri Health,
Mhm.
and then you went to Verilon. I knew one of the leaders there. Very like very good consulting company. They
Mhm.
have huge amount of knowledge. What was that jump from health system to consulting? Because you hadn't done consulting prior to that,
Yeah.
right?
Yeah, I hadn't, but I would say that strategists, even if you're working in a health system, and I think my title at TriHealth was project consultant, you tend to have a consultancy role, even if that's not your title, and even if you're an internal person, because you're constantly touching different parts of the organization in a strategy role, whether you have a project for the medical group or something for a service line, or you're doing something system level, and you're often put in these project management roles as well, even if that's not your role, to help convene opinions and drive consensus and provide information and keep these timelines rolling. So over the years, I had built this like level of consultancy skill anyway. Um, and I was very excited to join Verilon because they also have a really wide breadth of consultancy, where obviously they are the new home years ago of the legacy consultancy Health Strategies and Solutions.
Mm,
And Alan Zuckerman, who was the CEO of Health Strategies, wrote the book on healthcare strategy. So I was thrilled to go work there and be able to work with him before his retirement, and get a lot of exposure to more mergers and acquisitions and transactions, but also things that I hadn't really experienced, like physician compensation and fair market valuation, which Verilon does very well. And it was also really nice that it was a smaller consultancy. They're definitely a boutique firm, and they're more of a workshop model. So I knew that I wasn't going to be that traveling consultant that went out every Sunday night or Monday morning and came back on a Thursday or Friday and had spent my entire week in a different city. That lifestyle wasn't for me. Um, and their model is, you have a bunch of clients at a time, and you're working across maybe 5 to 8 or more projects and with different clients, and you're really at your office unless you're traveling to present or do interviews or something. But that exposure just across so many different types of organizations and projects was invaluable.
nice. Yeah, I've heard a lot of people enjoy their time there, especially because it is really steeped in strategy.
Mhm.
What what is strategy from the consulting perspective, right? What does that actually look like? Can you just give me an example of what problems you're being asked to solve?
Right. I think that's a great question. And there are so many different opinions and approaches to this. But when we look at it high level, you're really hoping to provide direction for the organization. And there's so many parts of that strategic planning process, or even the um, development of the process, right? That health systems often need help with, whether it's setting a vision, doing an environmental assessment, and really doing the work that maybe they don't have capacity for internally to provide them with an outlook of their market,
Mm,
right? Whether it's market share analyses, volume trends, things like medical staff development planning, where you're looking at the number of physicians you have in your market and how that compares to your patient population. All of these things are part of that strategic planning process, but I think it really starts with that mission and vision statement. And consultants often are the consensus builders and facilitators of discussion, where you can really step in and say, okay, here's all the information, what do you think about it? Okay, this is what you think about it. Now what are we going to do about it?
so you connect kind of that what everyone wants to do or the different ideas that everyone
Mhm.
has with what the actual action needs to be.
Yeah, and where there's strength and opportunities as well. Sometimes it's hard to see that from the inside out, or sometimes, especially for our operators, there's so many fires to put out at one time that it's hard to dedicate the, mental space and capacity to process all of these things. So often in consulting for strategy, that's what you're doing. You're someone to fall back on and remind folks that we have to keep moving forward and help them prioritize all the opportunities that they have. And measure that up with things that maybe we have to say no to as well. And that's such a
Mhm.
hard decision to make because our healthcare providers want to provide healthcare for their communities, but you often can't do it all.
No, absolutely, and I've seen them struggle with that, right? Because they
Mhm,
love, a lot of these people love their communities very deeply, and
mhm,
to have to sacrifice in one area for the future of being able to provide care is challenging.
mhm,
I can see where an external consultant would be beneficial for that.
mhm,
After your experience there, though, you went into the health system again for 3 years, right? You were
mhm.
the director there at Tower Health, and so
Yeah.
what caused you to leave consulting and go back into the health system?
I really wanted to get back, being a little bit closer to the decisions that were being made and then the consequences of them. When you're a consultant, and this isn't a bad thing, and we all know this, people who've been consultants, you kind of get to like, wipe your hands and leave at the end of the day. We, of course, want everyone to implement our strategies and to be successful, but really it's up to the folks doing the work to implement the strategies. And I was just ready for something new, another challenge. And I was looking to take this very broad range of skills that I had developed and maybe figure out a way to like get a little better at something more specific, right? And I've done this several times over the years, and it's always kind of a fun thing. And this was actually a brand new opportunity at Tower Health. They'd never had anyone in the title before. It was a new position in a really exciting market with a lot going on. And so I thought it would be a great opportunity to further my career progression.
Tower Health has traditionally struggled with physician retention, right? That was
Mhm,
when I spoke to one of their CEOs of their hospitals. That was one of the issues that he was brought in to solve, right? And he did
mhm.
well. And so I want to ask, what was the state of things when you came in to Tower Health?
Sure. It wasn't long after they had acquired the CHS hospital. So, for those listening, Tower Health was originally Reading Hospital. And Reading Hospital is very big. It's very busy. Actually, has the busiest emergency department in the state of Pennsylvania, or at least it did at the time that I worked there. I doubt things have changed. And they really had a mission to grow and provide care to a wider geography. And there were several for profit hospitals in the market that were being sold, and they acquired them. So it wasn't long after that happened that I joined. And in that process, those for profit hospitals had historically not employed a lot of the physicians in their markets. They had other arrangements with them, whether it was like medical directorships or professional service agreements, things like that. And Tower really thought there was an opportunity to bring more of those physicians into a tighter alignment through employment. And so that was really my role to find strategically advantageous practices to partner with in a more formal way and to bring them into the fold of the medical group, which was very large at the time that I was there. I think we had 1,000 providers or something, including advanced practice providers. And my role was to be like the person throughout the entire process where, okay, we're exploring this relationship and this acquisition, we're doing the due diligence, we're doing the fair market evaluation, which is where a lot of my experience from Verilon came in to play here, and then also leading the integration of them, which is what I was had exposure to during my fellowship, is integrating a new medical practice into an employed medical group, and even doing all of the, in conjunction with legal, all of the agreements around that and the negotiation.
Why do we see so many organizations struggle with the integration phase, right? They go up through the acquisition, they
Yeah.
deal with all of the issues with that. And then once they're acquired, 2 or 3 years later, some of these organizations are still kind of disjointed and kind of a mess. Why does that happen?
Oh gosh, I think there's so many reasons. I think some of it is just about resource allocation.
Mm.
So at my time at Tower, they had also acquired St. Christopher's Children's Hospital, and I was the liaison and integration manager, I guess. It wasn't a formal title, of St. Chris's Medical Group into Tower Health. And part of it is like it's such a hurdle to integrate systems, right? Even throughout Tower Health, we had 5 different medical staffs, 5 different credentialing, or like maybe 3 different credentials eventually, with payers. And so every time you had to move a physician or add them, they had to go through such a lengthy process. And so those processes and systems that are in place and combining them takes a lot of consensus building and honestly a lot of resources that sometimes health systems just don't have access to, whether it's the capital expense to combine electronic medical records, which Tower devoted a lot of money into when they acquired a number of the Drexel physicians,
Mm.
um, or just the human capital to like actually get the work done, right? When we think of how strapped, and this isn't specific to any one health system, but how like small and tight some of the teams are at health systems, it takes a lot of work to get everyone on the same page with these things. And you also have this staff of physicians and providers and nurses and everyone, from the janitor to the CEO, who have a culture and a history at an organization, and there's a way of doing things. And human behavior is just not wanting to let go of that stuff.
Have you found your psychology education useful in your integration role?
I think so. I think it's just been useful of how to frame things of like why people do things, even from a strategic perspective. Okay, why doesn't strategy work sometimes? Well, it's because this is how humans work, and it's not always what we want them to be doing.
That's great. No, I appreciate that. And so after that, you went on to do a strategic planning role, regional director. And
Yes.
then you did that for about a year, right? And
Yep.
then after that, you went back into the consulting space with SG2.
Yeah. Yeah, I had actually been applying to work at SG2, and this I don't think is a secret for a long time. I've also always been interested since I became familiar with them during my fellowship at Spartanburg, with what they do. And I was an SG2 user at several of the health systems that I worked at as a strategist, and it's a really exciting place to work, and you have a lot of like intellectual freedom,
Yep.
which I, at this point in my career, find very attractive. And there have been some changes within Trinity nationally that led me to look for another opportunity. And, that happens to all of us sometimes. But this was a great transition. And one of the reasons why I took on orthopedics here is because of its relation to enterprise strategy.
Mm.
Often, a lot of the things that we're concerned about in orthopedics are part of enterprise strategy, like physician alignment, right? Or facility building, if we want to build an ASC or outpatient surgery center. So it was a really natural transition, especially because I had already been familiar with the SG2 methodology from a consumer standpoint.
So, from a consumer standpoint, what is it? If you can just explain to the
Yeah.
guests who don't know.
Yeah. So SG2's primary product and tool is our impact of change forecast, which is a proprietary demand based forecast for healthcare. And we actually forecast tens of thousands of procedures and visit types across both inpatient and outpatient settings. And we do it every year on a 10-year basis.
Wow.
So if you have access to our forecast through your organization, or someone in your organization does, there is actually a forecast um, with volumes and a cumulative percent change for every year in that 10-year period. It's not like a 5-year and then a 10-year or something. It's every single year we have a percentage growth or decline. And we do this across over a dozen service lines and so many different procedures. And it's all based on our care grouper, which is also a proprietary way of matching DRGs and CPT codes with our service lines and procedure groups.
It's very, very cool. And how accurate is that?
Over the years, it's been shown to be pretty accurate, actually. They kind of do retrospective studies every now and then. It's older than 10 years now. maybe even 20 years.
Wow. Mhm.
And it has changed a lot over the years. It grows every year, right? We like add different things that we're forecasting, um,
That's
different categories or different procedures into that framework. And generally pretty accurate. There have definitely been areas where maybe we over and underestimated, but people keep using it.
That's awesome. Yeah, and
Yeah.
now, like, what a great time, right, with AI
Mhm.
and ML and all these things really
Yeah.
coming to the public forefront. And you have a really cool title, right? Being in the intelligence, area. What is intelligence, and why is that part of your title?
Unfortunately, I'm not a spy. I think that's what what people immediately go to when they hear intelligence, like, we're not the CIA. Um,
No corporate espionage going on.
no, no, and we're very, conscientious about, like, strategic intelligence as well. We're obviously trusted advisors to our members. We don't give strategic intelligence to each other, and, we're, very conscientious of that, like I said, but intelligence is really about taking all the noise that's going on about things, whether it's technology, the economy, how we care for patients through like clinical pathways and coordination, um, epidemiology and disease incidents, and wrapping that up into thought leadership.
Hmm.
So
Wow,
we gather this through obviously reading research articles that are published by physicians and health systems and scientists, our own data sources. We have claims data sources and proprietary data sources that we use to inform our opinions through our own unique and novel analysis, and news articles and what we hear from our members. So our responsibility is really to culminate all of that information and make a new novel opinion and informed opinion about the future of healthcare.
that's really cool. That's awesome. I
Yeah.
have a question on that. So I've talked with consultants on whether health systems should have their own strategy department, and it seems like
Mhm.
the answer is yes, and we're seeing that continuing to grow. Should health systems have their own intelligence department as well? Is that something that you think
Ooh.
is necessary to integrate, or should that stay in the consulting realm?
I think that the role falls into strategy departments often. I feel like I was doing this like on a market level when I worked at health systems, knowing kind of what's going on and who's doing what and everything. But from a national perspective or looking even regionally, this is a lot. It's a lot of work.
That's what I was about to say because I knew at Jeff, it's within the strategy department to do that.
Yeah.
And
Mhm.
just seeing the amount of stuff in the Philadelphia region, you were impacted by New York City, we're impacted by
Yeah.
DC. I can't imagine 2 or 3 people in the strategy department doing that as part of their daily workload.
Which is why we have almost 60 or over 60 people on SG2's intelligence team. And so imagine trying to do that at a health system level and have the depth of knowledge that we have. So, especially some of the more intricate service lines like cardiovascular or neurosciences, they know so much about the clinical parts of the service line as well, which is why we have experts dedicated to so many areas. So, not only are there service line leads like myself, so I lead our orthopedics service line intelligence, and I share spine with my neurosciences colleague. We have cardiovascular, imaging, women's, peds, um, cancer, right? So, along with orthopedics, so there's so many areas of depth here. And then outside of service lines, we also have experts that lead different intelligence teams around enterprise strategy, physician alignment, um, financial strategy. So we really have this like area of depth that's often impossible for someone to get to if they're like trying to do it all,
Oh,
right?
yeah. Wow.
Um,
Because you can collaborate. That's the other thing
yeah,
too. You can,
yeah.
orthopedic collaborates with all of your colleagues in other areas, and you can
Mhm.
see how they interact.
Right. And I often collaborate with our leads of like ambulatory surgery and general surgery to work on things like site of care shift, where we saw Most total joint replacements now are done outpatient, where in 2018 and 2019, it was the exact opposite. Most of them were done inpatient. So we often collaborate across teams as well to get deeper into subjects. And because a lot of things are shared, even though I own a lot of the thought leadership on outpatient rehab, I'm not the only service line that uses outpatient rehab, right? So I'm constantly talking to our neurosciences team, cardiovascular teams on what they're seeing in outpatient rehab in those specialties as well.
Where do they get the information? Is this some consulting agencies? I know they have some ways of doing this in terms of what they see from all their clients collectively, and they put together a
Mhm.
report. Are you getting this just from like all the public data? Where do you get your information from?
So we do have very comprehensive claims data, and part of that is because of our relationship with Vizient. So
Mm,
Vizient is traditionally a group purchasing organization that many of your organizations are members of. That are the middlemen between device companies and suppliers in your health system, and they help negotiate prices and do so much more work than that. But that's the basis of Vizient's original business model. And then they also have a clinical database that all the members submit information into. So that clinical database and the operational database that collect dozens and dozens of data points for um, hundreds of health systems across the country help inform our intelligence at SG2, along with some publicly available information from Medicare and Medicaid. We obviously have our own access to commercial claims products that are out there and a proprietary way of sorting those. So that we can then build the forecast and build all of our intelligence materials around it. But some of it also is a um, more of an artistry,
right.
right? Where, and this is what strategy is too, when you're internal and you're a strategist at a health system. Um, there's, professional societies. So every year, for example, I go to the annual American Academy of Orthopedics meeting, and I spend 4 days there listening to all their presentations and identifying trends and outliers and new technology that's coming out, and then follow up on all of those things. So this position is really like constantly learning and researching from so many different resources, literally anything we can get our hands on. In fact, I spend time even watching orthopedic surgeons on Instagram
Wow.
to see what they're talking about, and what journal articles they're citing or what issues they're seeing in their market or what they think is happening with knee replacements or spinal fusions, right?
Right.
So there's unlimited data resources, which sometimes can make the job hard because you're like, where do you stop, right?
Right.
But it is a really fun position to be in. I often say it's like being in graduate school, but you don't have like homework
That's
afterwards.
awesome. I like that description. That's great.
Yeah, yeah,
Wow, that sounds like such a. So I see why you've tried to get into SGT for a while. You'll have to let me
yeah.
know if there are any job openings there. It's no, it sounds very exciting, and I like the way that you do things. I have a tough question, and we can always edit this out. But
Right.
let's say in Philadelphia, right? Jefferson and Penn are their competitors in a lot of ways. What if they are both using SG2's services for orthopedics? How do you provide services to both of them in a competitive market without any kind of conflict of interest?
Okay. So, Cole, if we had two health systems in the same market that were competitors, which often happens, obviously, there's huge markets like Philadelphia that have a ton of competition in them. We have actually separate teams that deal with those, not from a service line expertise standpoint, but our account teams, right? And like I alluded to earlier, we're very conscientious about strategic intelligence. So we're not doing like market level reports on every single thing that's happening in your city and how it compares to what your other, competing health system is doing. But because we have a huge and very responsible and confidential account teams with our directors of strategic analytics, where every one of our organization members has a strategic analytics director
Oh, wow.
and a client relations person, and then people that support them under that. We have very strong lines of what kind of information gets shared across them. And we often blind stuff, even if examples, even if it's from a different market. Okay.
Oh,
So
nice.
if a health system came to me, Jones Health, we'll make it up, right? And said, what is everyone doing about ambulatory surgery centers?
Yep.
And I just talked to Smith Health 2 days ago, and they said, da 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 da. Even if they're on opposite coasts, we're never saying without permission, oh, well, Smith Health told me this,
Ah,
and
interesting.
you should do that. We're always saying, oh, another one of our members, right?
So that's different than a lot of, because a lot of consulting organizations do engage in that kind of practice.
Yeah, but it's so important to our work of having these relationships with our members,
Yeah.
and we really value what they share with us. That we never want to violate that
Wow.
trust, and I really think that everyone should work under that premise. We never want to share sensitive information, and I think we're really good at not doing that. We always respect boundaries for folks, but there's also a lot of opportunities where health systems do want to share that information,
Right.
right? um, where we have a health system in Florida that I just did a case study with and featured in our orthopedics newsletter,
Right.
to highlight their spine program, right? Because they want to share what they're doing.
Yep.
They don't think that it is, maybe they think it's just good that everybody should do what they're doing, or that it's a great example and they want to share that. And we have so many of those stories and case
Right.
studies. And the other thing that we do is make networking connections.
Mm.
So, probably not in the same city, right? Because health system A and B don't want to have either one of their strategic positions, right? But what we'll do is if we have, Jones Health comes and says, can we talk to a different member about total joint replacement programs? And I have someone in mind, I'll email them, say, are you interested in, would you be willing to talk to this member in a different market about this? And they'll say yes or no. And
Right.
then we would connect them. So that's a role that we often serve into.
That is really cool, and what a respectable and honest way of doing things. So thank you for sharing that, because I think a lot of people who are, out looking for some of these services, they want someone who's honest and trustworthy. And as I mentioned, not all consulting firms are like that. And so I really do appreciate you sharing the methods for that. And
Mhm.
thank you for coming on and sharing about your whole kind of career and journey. It's such a cool place to work and such a cool journey as well. It seems like you've kind of crafted yourself to be, a
Yeah.
perfect individual for this job.
Well, thanks for saying so. I've really enjoyed every position that I've had, and I think all of them have contributed to who I am as a professional now. And who knows where I'll end up at the end of my career? I don't know. I still have a long career ahead of me. And really enjoying the work that I do, and being able to touch so many health systems in such a impactful way with our forecast and with our intelligence.
I'm definitely going to be, creating a job alert for SG2 after the conversation. So,
Well,
and I
thanks.
encourage a lot of our audience too, as well. If it's something that interests you, we're going to, of course, link to SG2 here so you can go and check them out, and link to you as well, Donnelle. So thanks again for coming on.
Thanks for having me.